Good evening. Senior Care and Lifestyles welcomes you to join us for the next 28 minutes this evening. Tonight we are going to talk about Medicaid and some other areas, and I have a guest with me from Senior Planning Services, and they're Medicaid specialists that are knowledgeable in all aspects of Medicaid process, including clinical and eligibility for both individuals in the community and in skilled nursing facilities. Tonight we have with us Neil Stern, Medicaid specialist. Welcome, Neil. First time to our show, and we're going to enjoy ourselves, and at the same time we're going to help educate our population on Staten Island and also in the other boroughs, because our show is broadcast throughout. So we're going to talk about Medicaid tonight, and it might seem that we have to navigate some waters, but we will get through.
Absolutely.
All right. So now let's start with an overview. Let's tell our audience what is Medicaid, because I don't know if you're aware, many people come into the hospital and they say, I have Medicaid, but it's really Medicare. People do get the two terms confused. So let's focus on Medicaid.
Well, absolutely, Marianne, and thank you so much for the opportunity to speak to your viewers tonight. There's truly so much to say about the Medicaid application process. There's so much that goes into it. And the truth is that Medicaid has many different facets to it, because there's community Medicaid, there's nursing home Medicaid, there's Medicaid for people that live in the community who aren't even seniors. So obviously, you know, talking about Medicare, the scope of our conversation tonight is limited to seniors who are applying for Medicaid, be it in the nursing home, be it in the community, and really to get a better understanding of what this is all about. Now, Medicaid is in essence the government's version of long-term care insurance. That's really what it is. And when you think about that and how important that is to people, and I'm sure many of our viewers here tonight are just naturally concerned about the cost of quality care.
Absolutely.
And it's a really serious issue, and people want to maintain that quality of life that they've grown accustomed to, the level of care that they've grown accustomed to. And thankfully, Medicaid is actually a safety net for those people to ensure that they can actually continue to live with the very same quality of care that they've grown accustomed to. And it becomes critical to really understand how to ensure that you successfully navigate the waters and you actually achieve your goal of obtaining eligibility.
Right, so we're going to try to get them in the right direction. What does Medicaid actually cover? Because many people don't really know that answer.
Right, and it's a very broad answer, because as we said, Medicaid is multifaceted, and it touches on so many different things. But again, being that the scope here tonight is to focus on the long-term care aspect of Medicaid and the nursing home and the community, clearly the nursing home portion of it is easier to answer. A person is in the nursing home and it will take care of all of their financial obligations in essence when they're in the nursing home. But even for people who are in the community, there's tremendous value to the Medicaid program, because there's so many things that are covered, such as physician visits and clinics, visits to clinics, prescription drugs, non-prescription drugs. Sometimes Medicaid will cover home care. You know, there's a certain amount of hours that you may be entitled to. Adult daycare, you know, there are times where it'll cover even transportation to the doctor, so that's very important as well. But above and beyond that, it covers all the therapies. You have your physical, your occupational, and your speech therapies that are covered through that. You know, mental health services can be covered through that. Lab costs can be covered. X-rays can be covered. Durable medical equipment, such as DME, which is otherwise known as DME. Wheelchairs and various other durable medical equipment. So clearly the scope is very broad, and Medicaid covers so much.
It does cover a lot, and depending on the person's need. Many people think that you have to be a certain age for Medicaid. That's a mistake, yes?
Yes, it is a mistake. I mean, I guess if you had many people, most of the people who will be on Medicaid will be above the age of 65. That is the reality. It is a, you know, it is a long-term care program for seniors. But in essence, there are other scenarios where one may qualify for Medicaid, such as a scenario of disability. If there's a permanent disability, or whatever the disability may be, that may be inclusive of the Medicaid program. There's other scenarios where someone may be blind, and that can be somebody that's included in the program. There are minor distinctions in terms of how it's administered. Medicaid is typically administered by Medicaid through the Board of Social Services. Very often when someone is unfortunately disabled, the application process may be through Social Security, but at the end result, ultimately, they will be issued a Medicaid number, and in essence, it's Medicaid to all of them. So the answer to the question, by and large, there is age requirements, but there are scenarios that are outside of that.
Because in the skilled facilities today, when you walk in, they're not all patients or consumers with gray hair, walkers, and canes.
Absolutely.
There is a younger factor there between 40 and 50, sometimes 30. There are some people very close to in their 20s, but they are very disabled.
Exactly.
So,
and thankfully, that's covered as well.
Yes, that's important, because I think a lot of consumers don't realize that. But you can go into any skilled facility and see these younger people that are disabled.
How very true.
What about citizenship? I've really never heard an issue about that before. It's only the last, let's say, 10 years where it's been an issue because of our immigration wave that we have coming over. So what is the issue for Medicaid as far as being a citizen?
Well, that is a great question, because we find this a lot where people are going to apply for Medicaid, and you're right. There is certain specific requirements that need to be met in order to be eligible for Medicaid. Well, just to give you the broad sense of the answer and to give you the general criteria, obviously if you're a New Yorker and you're an American citizen,
not an issue.
We're not talking about that.
Right.
But there are additional people who may qualify. Someone that's a U.S. national may still qualify. If you're a permanent resident, you may qualify. A legal alien may qualify. So in actuality, there are categories outside of direct citizenship that can still qualify for Medicaid. And as you said, as it would relate to disability, that's so important, because when you walk through the halls of a nursing home, there are all kinds of people who are living in this country, and thankfully many of them may qualify for Medicaid.
And what we're seeing now is with the latest waves of immigration, it comes in waves. It will come from one country. It will come from, if you want to say, an Eastern country, then a South American country, and now the Ukraine type of countries. So now what you're seeing is nursing facilities, the skilled nursing facilities, some of them are designating units to this. And absolutely hiring staff that can converse with it.
Absolutely.
And I see that in my acute care facility. And lucky for me that I have so many nurses and physicians that speak Russian and Polish, that it's a great help.
Right.
But I know when I speak to their families and, the limited language, and they're very concerned when they have this disabled adult, elderly person, what am I going to do? So, of course, we direct them to social service, So citizenship is not going to be a tremendous barrier.
Not necessarily.
Okay. Now, this is where people really get crazy. Does Medicaid affect Medicare Part A and B?
Well, I like the question, but I wouldn't say that it affects Part A and Part B. Of course, it would relate to Medicare Part A and Part B. And just to better explain the answer to that question, Medicaid is the very last payer. So very often with Part A and Part B, there may be co-payments, co-insurance. You may have deductibles that you're responsible for, and Medicaid will pick up that co-insurance and that co-payment. In essence, to say it in other words, the Medicaid eligible individual will not have to pay that portion of it. Now, this actually has a tremendous impact on a nursing home, because although Medicare may cover up to 100 days, after day 20, the person in the facility is responsible to very significant co-payments on a daily basis. So if they have secondary insurance, they'll be fine, but if they don't, Medicaid will cover that. So in general, Medicaid will cover the deductibles, co-insurance, and co-payments.
Absolutely, I know. Now, I was amazed the other day reading about Medicare Part A, B, C, D, E, F, G. Does it go to J, maybe? So my question is, you explained about Part A and B, and why do we have the D premium? Why is that important?
Well, that would relate to the drug, to the drug program where prescription drugs would be covered through Medicaid, through Medicare. However, when it comes to paying premiums, it's very important to understand that the Part B and the Part D premium, as it relates to both of them, that when an individual is in a nursing home, although his income needs to be turned over to the facility, they may be, people may be concerned about that. Well, how am I going to maintain the premiums that I need to pay?
Right.
And it's really important for folks out there to understand that there's no practical implication, because although their income is being turned over to the facility, they can actually keep the part that was being used for their Part B premium. The facility will be paid through Medicaid.
It's inclusive.
It'll be on that budget letter. So Medicaid will cover this difference by paying the facility, but people should know that they will be able to maintain that premium. And as it would relate to the prescription programs, Part D, very often when people are on Medicaid, they can get onto a benchmark policy which has no premiums. So it's great news for people out there on Medicaid. There is a potential scenario with no premiums, and Medicaid will pick up all of that.
Okay, that's good to know. So, of course, many families are faced with the question, they have to put a loved one in the skilled facility.
Absolutely.
Okay? Now, what happens when Dad goes in and Mom has this house?
Okay, what about the house?
Right. What people ask me all the time.
This is such an important...
Is my house going to be taken away? Every day they ask me that question.
And I'm so glad that I have a forum here to answer it. And it's one of the big concerns on so many different levels. People are attached to their homes and they don't want to part with it, and naturally so. The first part of the answer, and I'll break it into two parts. I mean, people that are going home, if there's an intent to return to home, there is no concern whatsoever about the home if there's an intent to return home.
After rehab.
Correct.
For an example, short-term rehab.
So even if people need Medicaid for the time being, if their intention is to return home, you're not required to do anything about that. It is safe. And as you mentioned, when there's a community spouse, it is safe. I mean, there's no concern that that will have to be parted with. It gets a little different when you're dealing with a single person who's in a facility for long-term care. And the truth is there's no cookie-cutter answer for Medicaid because things vary from county to county, from state to state.
I know, yeah.
So there's so many differences that you have to be cognizant of. And in certain counties, what will happen is Medicaid will put a lien on the home to recover what they paid on behalf of the Medicaid applicant. Whereas in certain counties, you will be completely ineligible if you don't sell the home. However, I do think it's important to add that there are many exemptions and exclusions to this rule. I mean, just to touch on it, an example of where you would be able to keep that home. If someone has a child with a permanent disability, they can keep the home. They don't have to give it. And as we referenced before, if there's a spouse in the community, there's no concern. You can keep the home. But there are other scenarios as well where children lived in the home for 2 years. That can be possibly a scenario where they may be able to keep that as well.
When you say children, you mean children or you mean adult children?
No, it can even be adult children.
Right.
Meaning if you are an immediate child and you lived with mom or dad in that home.
Taking care of them.
Precisely. Medicaid gives you that gift potentially where you may be able to hold on. And there are other examples. So again, as I said, there's so many aspects and facets to this program, but many people don't realize that the home may be safe.
Right. We probably could spend an entire show just talking about the home.
And you're not wrong.
I know. Now, what is the financial resource limit that they can keep and still qualify for Medicaid in the community? So we're basically, we're talking about Staten Island and the skilled facilities.
Well, again,
is there a...
Yes, and I want to answer this question in two parts again, as a single individual, then as a married individual. But then I feel that it's worthwhile to touch on general asset preservation, which is out there for everyone to take advantage of if you understand the program. If you are a single individual, you are allowed to have $14,400 and still qualify for Medicaid. But above that, you may need to spend down those dollars. And I'll interject immediately and state that even for a single individual, there are asset preservation strategies, such as a promissory note, which is a way to preserve some of those assets. Obviously, when we're dealing with a spouse, that is an entire different scenario because, folks, here's the rule. Medicaid will not impoverish the community spouse. That is the guideline. So then the question really becomes, how much is the community spouse allowed to keep? And that itself is a complex, mathematical equation where we will determine the precise amount that the individual spouse is allowed to keep. And again, this is so important to understand, because when people are spending down towards Medicaid and they misunderstand this and they do it incorrectly, you can quickly spend tens of thousands of dollars that you had no need to spend. And above and beyond all of that, even with this being said, there are asset preservation strategies such as a spousal refusal or perhaps a promissory note, which is something that I referenced a moment ago.
Okay. And basically, as far as qualifying for the nursing home Medicaid coverage, I think that you were pretty clear about that anyone, our viewers out there that are going to be faced with that, I'm hoping by the end of this show, they're going to feel very comfortable about questioning and making a phone call. Because I think we're headed in the right direction. I want to make people understand and then take advantage. Now, what is the difference between the community Medicaid and institutional Medicaid?
Wow, now that's definitely a broad question. Obviously, the scope of services completely different. When we're talking about community Medicaid, we're talking about home care.
Right.
We're talking about all the items that I answered before, such as X-ray lab service, prescription drugs, and everything that comes with that. In the nursing home, we're talking about living in a nursing home and having that massive bill really being taken care of for you. But that is just in terms of the scope of the service. In terms of the application process, there are distinctions as well. And it's certainly worthwhile to note them here tonight.
Good.
So the first one that I'll bring up is on an income level. How much income are you allowed to earn and still qualify? Well, in the community, there is a cap of $820. Now, that does not mean that you can't get benefits in the community if your income is above $820. There are strategies that can be employed, such as a pooled income trust, and other strategies that will allow for someone with income greater than $820 to still qualify.
Can I just interrupt you?
Absolutely.
On the news last night, the gentleman was on Medicaid, and they said he made $820. Are you talking monthly, yearly, weekly?
Thank you. I'm talking about monthly.
Okay.
So
this gentleman made $820 a month. It was on the news. He found a bag of money, $800 or $900, and he actually brought it to the police station. After the 30 days, they called him back. Nobody claimed it. They gave him the money. And everybody was saying, geez, you're such a good guy. Medicaid stepped in and said, we're no longer going to cover you because you have now an additional $900. It was
Correct.
Very sad.
that is a sad story.
But that was exactly $820 that he got.
You're really highlighting a greater point about Medicaid, that there are rules and there are guidelines that must be adhered to. And if we're on target with understanding the guidelines, you can navigate this process because you better understand what you need to do. But a minor deviation, one change, one lucky finding of $900, and there can be a lot at stake. So definitely, and it's something that.
Well, they followed up and they, rearranged. Then the judge or the mediator said, as to the spirit of the law, it's okay.
Right, and I'm glad that was the resolution they reached.
Yes.
But there's another distinction, just to answer the question about the differences between community Medicaid and nursing home Medicaid. And this is a really, really big one, and it's the 5-year look back. When you apply for Medicaid in the nursing home, there's a 5-year look back. Medicaid doesn't just want to know how much money you have today. Right. They want to know how you got there.
It used to be 2 years, 3 years. Now it's 5 years.
Now it's 5 years. So they really want to pay attention to every dollar that came in and came out. They may not question every dollar, but they can. And that's a 5-year look back period to determine how have you handled your funds over the last 5 years, meaning you may need the support today, but how did you get to that point? In the community, however, it is a 1-month look back. So thank God it changes the dynamics just a bit.
Because in 1 month, your whole life can be turned upside down. Example, Hurricane Sandy.
Correct.
1 month, your whole life can just go down the drain.
No doubt. I would venture to say in 1 day.
Okay, so that's, I know, I deal with, all these situations on a daily basis, so I understand. Now, we're talking here as spouse living in the community, do I have to spend down? You hear people talking if they know that in the next year their spouse is headed for the nursing home or skilled care facility, and people are giving them this free advice, their friends, you better spend that money, you better give it away for your grandchildren. And I tell them, you have a 5-year look back period. What can they do? How much do they have to spend down? How much are they allowed to spend?
So that, again, it's a great question. We kind of touched on it a little bit before when we were talking about the allowable resource limit for the applicant. And I had mentioned strategies that can be employed, but the good news is that Medicaid actually has an allowance without any strategy. If you are a community spouse, you can potentially keep close to $115,000 of the money that needs to be spent down. Now, I wouldn't say that broadly because we would have to look at the exact scenario that's in question.
Do they have a Lexus and a Mercedes? And
we have to look at the entire picture before that assessment is made. But there is an idea of having the community spouse not being impoverished and holding on to their money. So that's very important because that limits the requirement to spend down.
The mindset of the community right now, today, this minute is, if I put my spouse in a skilled facility, they're going to come and take my entire bank account, whether it's $20,000 or $50,000. This is the mindset, and this is a very important point that I would like you to, emphasize, is that they are not going to empty that bank account.
That's absolutely true, and I'm so glad to be able to talk about this tonight because
they all believe it.
It's a misconception, and it would clearly depend on the circumstances that they're in, but certainly many people have been able to, through the letter of the law, been able to preserve assets. And obviously it can go beyond that, and I touched on this before, where there's a concept of spousal refusal, where the spouse can further engage in asset preservation through that approach.
Right. Okay. So that's what, a lot of the viewers, they like to hear numbers, they like to hear stats, because that's something that they can hold on to, and they will remember that number.
Yes.
If assets were transferred within that time frame, do they have to be returned? Okay.
There's no violation of any law by transferring assets, but obviously the question really is as it would relate to Medicaid benefits. Would Medicaid allow someone to transfer their assets away and then still qualify for Medicaid? The answer is not necessarily. If you've engaged in a transfer for less than fair market value, Medicaid can then assess a Medicaid penalty saying, look, you've transferred X amount of dollars, we're not going to provide X amount of coverage because that was not within the guidelines of Medicaid eligibility. So the answer to the question is, of course, in order to receive the benefits, it would be appropriate to return that money.
I'm heading specifically that people want to transfer their house. If they know that that's skilled facility is coming, they want to transfer their house to their child or children. That's an issue, and that's one of the things that's going to be looked on.
Absolutely.
Okay.
But as I said earlier, there are scenarios where that would be okay. So you really have to know the individual circumstances so you can take the correct action.
Right. Okay. And I imagine the same. Now, it's you read an AARP, not that you would read it, but baby boomers are reading it very closely, every word, and they're talking about giving the gifts. It used to be giving gifts to your children on a regular basis, but now, of course, they're talking about the grandchildren, setting aside money for college. Is this acceptable way to downspend?
Well, for the care of the individual applicant or the spouse would be an acceptable way to spend down the portion that needs to be spent down. But obviously, as we discussed earlier, there is a portion of the money that's not going to be touched. So anything that you do with that side of the money is okay. But the portion of the money that you are spending down, the answer is no, a gift would not be appropriate and within the guidelines of Medicaid eligibility. So, sometimes people have a misconception, well, my accountant guided me that I can give each child.
Every year I can make a little donation to my child's bank account.
Unfortunately, the IRS and the Medicaid program are not on the very same track with this concern. But again, there are scenarios, and you really have to understand the particulars of the circumstances. So as a general guide, as in everything that I'm speaking about here tonight in a general way,
yes,
the answer is no, you cannot transfer it to your children. You can't do any of that.
Okay, that's very clear. Now, I'm sure the audience and our viewers have seen what's behind us, and here it says application documentation is important.
Absolutely.
So I'm going to ask you now, for our viewers that are interested in what we're speaking about, how do they do this? Where do they go? Who do they call?
Okay, well, a very good idea would be to speak to somebody who understands Medicaid and can give you the proper guidance of what you need to do. And one of the good things about what we do at Senior Planning Services, we do offer those free consultations where folks, whether or not you understand the process thoroughly, you would benefit by better understanding what you're allowed to do. Yes, you may keep that home, or no, you may not, but to really understand how to take the bull by the horns and to really get this done correctly. And you can call us toll free, and we'll be very happy to give you the guidance and the support that you need. And our 1-855-S-PLANNING, S-PLANNING is our number. That translates to 1-855-775-2664. You can call us, and we'll be there for you to just help you navigate this complex issue and truly to obtain the benefits that you are entitled to, just making sure that you understand your responsibility and are better prepared to navigate this in the most appropriate fashion.
Right. What we're doing here tonight is just looking at the icing on the cake.
Absolutely.
You got to get through the icing, and you got to get to the cake. But I am so happy that you were here. I'm thrilled you were my guest, because these are questions that I hear every single day from the consumers, because I work in a acute care facility, and people, they have these misconceptions, and there are myths. Oh, Medicaid, that's it. Oh, everything you own is gone. And we try to guide them, you know. But you really answered the questions very clearly.
Thank you.
I'm very glad that we did this show. So I'm going to say thank you for coming, and it was a pleasure, and I hope the viewers enjoyed the show, and good night.
Thank you so much.